Hi, I'm Angela with Angela's Student Nurse Toolbox, and today we're going to go over EKG strips, what essentials you need to know as a student nurse. All right, when we're looking at a heart rhythm or an EKG, you need to know the few basic points. The first one is our P wave. This is when the atria are contracting. Okay, so the atria contract, then they're going to relax. That's your PR interval. And then the QRS, this is when your ventricles are going to pump. So it's like usually an upside down V. Okay, so the big V shape is your ventricles contracting. And then the repolarization is your T wave. This is where the ventricles are recharging again to get ready to pump. Okay, so you have a P, QRS, and T wave with EKGs. So let's talk about some of the rhythms. First one is going to be normal sinus rhythm. So what that means is that the electrical aspect of the heart, it's pumping the atria pump. They get that message, make the electrical goes down the Purkinje fibers, and the heart pumps. Okay, so atria do their part, the ventricles do their part. And every QRS has a P wave. So the P wave are the atria that are pumping. QRS, T wave. P, QRS, T wave. So that's what an example of normal sinus rhythm is. So let's look at the next one. This would be an EKG recording of normal sinus rhythm. Every QRS has a P wave. Right before it, QRS and T wave. So that's normal sinus rhythm. So that is any heart rate between 60 to 100 is normal sinus rhythm. That's your normal levels. Sinus bradycardia. This is where it's very slow. Patient's heartbeat is going to be less than 60 for sinus bradycardia. This could be side effects of medications, especially beta blockers that can cause sinus bradycardia. Digoxin can cause sinus bradycardia. Your patient may be symptomatic, weak, dizzy, lightheaded when they're in sinus bradycardia. Okay, and here is what sinus bradycardia looks like. It's very slow, the beeps. Okay, so we want to make sure we don't give them any other medicines to slow them down. We don't want to know how low they're going to go. The next one is sinus tachycardia. So it's beating fast. When somebody's heart's beating this fast, it's difficult for those ventricles to get that blood to pump it out because the atria are just squirting so fast. They squirt and then stop, squirt, stop, squirt again. So it makes it very difficult for it to get a full load of blood to pump to the rest of your body. So patients with sinus tachycardia might feel lightheaded, dizzy, because they would have decreased cardiac output. Things that can cause this: energy drinks, stress, anxiety, panic attacks. Some medicines can cause sinus tachycardia. Fevers can cause sinus tachycardia. So this is what it would look like on the strip. So this is any heart rate greater than 100 for sinus tachycardia. Let's go to AFib. With AFib, it's not in a good rhythm. That's usually the big thing with AFib. It's not a regular rhythm. It beats when it wants to. Your heart's just messed up. It's not getting the message when it's supposed to beat regularly. And you have lots of P waves, or you could have absent P waves. You're not seeing P waves. So the atria are just doing all kind of stuff. So they're kind of just fibrillating. They're not pumping each time that they are supposed to. They're just kind of trickling. So big thing with AFib, we're concerned because it's not pumping out all of that blood at one time to go to the ventricles, some blood can pool up in the upper heart and form a blood clot. And patients that are in AFib rhythm tend to be on blood thinners to prevent them from throwing a clot. If they throw a clot, it can go to their lungs and become a pulmonary embolus, to their brain and be a stroke or a CVA, or if it's in the heart itself, it can cause an MI. So let me show you what this looks like on this strip. We have a whole bunch of little P's. You can't make it out. I usually have my students look at the QRSs, and you just can eyeball it, that between each one is different spaces. So it's an irregular rhythm, and you really can't make out a P, or there's just a whole bunch of P's. So the atria are just kind of quivering instead of pumping and making one P wave. So AFib, and I also say that the P's might look like a little meth mouth. That's what I tell my students. It's just all these little broken up little things, squiggly lines that you really can't see. So that's how they kind of relate that in my class. So here's a rhythm with it. We have some QRSs that are close, some that are further, and you see all the little squiggly lines that are happening? That's AFib. Huge concern for clots. Atrial flutter. It's more rhythmic, and the atria are just pumping, pumping, pumping. Not all the way, just kind of quivering, but they kind of quiver in a rhythm. So this one's a much prettier rhythm. I have a whole bunch of pretty little P waves, all about the same height and size. And I call it like a little picket fence. And here my QRSs are like little houses. It can still be irregular in rhythm because those QRSs are not evenly spaced, but I tend to have a lot of those little picket fences. So just think that if you're living in the country, not in the city. Okay, so atrial flutter, they can still feel lightheaded, your patients. They can still throw clots. And this is what it kind of looks like on a strip. This one's a more regular rhythm right here because the QRSs are pretty much evenly spaced. And here are my P waves. I have a whole bunch of cute, pretty P waves. So atrial flutter tends to be a prettier looking rhythm. VTAC. What's happening with VTAC? I have all of these huge, big, tall V's. Okay, and I don't have many P waves. The ventricles are just pumping, 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 but there's no blood that the atria gave them. So VTAC is a lethal rhythm. Okay, they would have no cardiac output. Your patient would be unresponsive, and you would need to be doing CPR or shocking them. So here, this is what VTAC looks like. And remember, anytime you see something like this, always assess your patient first. I had one where the grandpa had his grandbaby sitting on him, and the child was playing with his telemetry monitor, jerking it back and forth, and it looked like grandpa was in VTAC. Also, some people brushing their teeth very forcefully can cause it to look like that because they're hitting their wires. So before you go run and shock them, to make sure they are truly in V tachycardia. Okay, so here's some VTAC. We got some big ones, little ones. Not good. And now we're got them back in a rhythm. They must have shocked them. So let's talk about VFib. So VTAC, the ventricles are contracting, just crazy, but they're not filling up with any blood. VFib, just think if I'm not getting any oxygen because I didn't get any blood to pump around, now those ventricles are just kind of quivering, okay? And that's what you're seeing right here. So they're not squirting anything out. If you don't shock this person soon, they're going to the light, okay? So definitely a shockable, lethal rhythm. And here's an example of VFib. Definitely need to shock them to bring this person back to life. So it's important to know which rhythms are lethal, what you need to go really run to the room for. And this is definitely one of them. This is PVCs. What happens is the heart, as it's beating, sometimes the ventricle gets excited and pumps all by itself, but it didn't fill up totally with blood, so it's just kind of working on its own. A lot of patients that have PVCs that can be related to energy drinks, too much caffeine, or electrolytes, especially their potassium, calcium, or magnesium. They could all be either too high or too low. So if you have a patient that's coming in with lots of PVCs and they say they feel like their heart's skipping a beat, check those labs. It might just be electrolyte issues that you need to fix. And here are some PVCs every third beat. That's why they're called trigeminal. So I have 1, 2, 3. Here's a PVC. 1, 2, 3. And PVCs are usually big, a lot bigger and wider than a normal heartbeat that you're seeing on the EKG. Okay, so a lot bigger and wider. And they can maybe go in opposite directions. Those are PVCs. So there was one right here. And there's one that looks a little different this way. Here's another one. So those are what PVCs look like. The next rhythm we're going to talk about is first degree AV block. Okay, so this is where there is a problem with the electrical part of the heart with the SA node getting that message to the AV node. Okay, so the SA node is up here in the atria, and for some reason there's an issue, and it's taking a little longer for that ventricle to get the message, it's your turn to pump. So you'll see there's a longer distance from their P wave until where the ventricles pump. So here's my T wave, P wave, QRS, T, P, and it's a lot longer. It's a space. Okay, so that's what first degree AV block is. So it's atrioventricular. Think of, you have a construction. This one I might just have slowed down the traffic because they're doing construction right there in 8 o'clock morning traffic. Okay, and you might have to just slow down. It's just taking you a little bit longer to get to your destination. So that's how I kind of refer to that one. If you have a complete heart block, what's happening is the heart's pumping, but they're not pumping together. Sometimes the atria pump and the ventricles forgot to pump, because that's what's happening here. I have a P wave and they didn't get the message at all. P wave, QRST, P, forgot to pump, didn't get that message. So patients with this would really feel decreased cardiac output. Think of if you're driving and all of a sudden they just closed the road and you can't go the way you normally did on the interstate. And now you're trying to drive all kind of ways to get to your destination, back roads. It's just taking a lot longer. And then sometimes you might hit a dead end. Just think that's where the P wave is. And there's no QRS to go down. So then I have to kind of turn around, try again, a different road. So think of construction, the whole road's closed, and you're having to pick an alternate route. An atrial pacemaker, this is a pacemaker that's placed in the atrium to get the heart to stimulate, to start that electrical impulse for the heart. And what you would see on the strip, these are called pacer spikes, pacemaker spikes. This is firing to get that atria to start going, to start the whole process of that heart, to keep it at a certain level. Some people might have it paced at 60 beats per minute, different levels. The doctor, your cardiologist, would program it to where you're not symptomatic. Because a lot of the people that get pacemakers, they have bradycardia. It's very slow, and they need something to tell their heart, you got to keep this rate and rhythm up. A ventricular pacemaker, this one's placed in the ventricles, and it tells the ventricles when to fire. And you would also see pacer spikes on those. So some people have an AV pacemaker, an atria, and a ventricular pacemaker. Some have them on demand, where if I get below a certain heart rate of 60, then it will fire. And some are a continuous pacemaker. It's going to do it for every beat. So it just depends on what that patient has. But they would have what's called pacer spikes on their EKG monitor strip. Asystole, that's your flat line. Okay, they are going to see the light. The Grim Reaper is here. They're out. They're done. Okay, so asystole, definitely a lethal rhythm. So let's guess some of these heart rhythms. So the first one we're going to look at, if you're looking at this strip, so let's just assume this is a 6-second strip. What I usually tell my students, well, that's how I tell mine, that this is a 6-second strip that they have for test purposes. They're going to count the QRSs they have. So this is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So each QRS is how fast the heart rate's going. So I multiplied times 10, so 15 times 10 is 150. So every QRS has a P wave in front of it. They're evenly spaced. So this would be sinus tachycardia, being that it's at 150 the rates, going very fast. The next one. So this next one, assume this is a 6-second strip. 1, 2, 3, 4, 5, 6, 7, 8. So the heart rate, we're going to add a 0 to it. It would be 80. They are evenly spaced, or QRSs. And everyone has a nice, pretty regular P wave before each QRS. So this would just be normal sinus rhythm because it's between 60 and 100. Okay, let's look at this strip. All right, when we're looking at these QRSs, you notice right off they're irregular. Okay, some are evenly spaced, and then it's bigger space, 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 bigger space. And then when we're trying to identify a P wave, we just have a bunch of these little squiggly lines. Sometimes it looks like we might have a P wave, other times we don't. So it's irregular. We can't find a P wave. This is a fib. And the heart rate would be 1, 2, 3, 4, 5, 6, 7, 8, 9. So 9 QRSs, that's what I counted, add a 0. So the heart rate would be 90. And this is definitely AFib. And remember, key point with AFib, they can throw clots. Let's look at this one. All right, our QRSs look like they're evenly spaced. So let's count them, and we have a P wave for each. So let's count 1, 2, 3, 4, 5, 6, 7, 8, 9. So the heart rate, if I add a 0, would be 90. This is a normal sinus rhythm. Okay, let's get to the next one. This one looks regular with the QRSs, but I have lots of P waves. Here's our little picket fence one. Remember I told you A flutter is usually pretty? This is classic A flutter. Okay, and the heart rate would be 1, 2, 3, 4, 5, 6, 7, 8. The heart rate would be 80 if we add a 0. Okay, let's look at this one. Okay, we only have 3 whole QRSs on here. So if I add a 0, that heart rate would be 30. And here's my P wave, QRS. And it looks like I have a delay in my my P waves to my QRS, so I might have like some type of heart block also. So this would just definitely be sinus bradycardia. Okay, we definitely don't give them a beta blocker to treat this because then they will be asystole. Okay, here's another one. Okay, they look regularly spaced or QRSs, but I got lots of pretty P's. Okay, this one again is a flutter. So let's count the rate. We'll count those QRSs. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So it's almost tachycardia. It's close to being a tachycardia for this flutter. It's a very fast one. Okay, this right here, this is a big PVC, okay, that we would see. Remember, if you're throwing lots of PVCs, it could be related to your electrolytes, those potassium, sodium, and calcium. Also, and magnesium. Sorry, it's potassium, magnesium, and calcium are your ones that can affect the heart. Could be energy drinks, lots of caffeine. They could be having a lot of these PVCs. Here's another one. Now this one has these little spikes before the atria fire, before those P waves. So this is a pace rhythm, okay, because we have these pacemaker spikes before each P wave, making sure the atria fire. Okay, so here we go. We had, looks like a nice little normal rhythm, and then all of a sudden we have 1, 2, 3, 4, 5 big, it looks like PVCs in a row. When you have more, 3 or more, this is a run of VTAC, okay, because it went all by itself. They had these 5 beats, and then boop, their heart fixed itself on its own, and they're back into a normal rhythm. And this can happen with patients. They can have runs of VTAC, and that would be something to report to your doctor. Okay. Here's the next one. This is some V-fib. I have a few little triangle V's, P waves maybe in here. It's very, very fine. This was a lethal rhythm, so you definitely want to shock them before they become totally flat with an asystole. Okay, let's look at this one. This one's a QRS. Here's a P wave, and it takes a long time for it to tell those ventricles to fire. P wave, nothing happened. P wave, so this is an AV block, a heart block, okay, because the atria fired and the ventricles never got that message. Remember I talked about the construction, or that road's closed and you have to find all these back roads trying to get to those ventricles to get them to contract. And here's our last one, and this is asystole. There's not much going on. There's no electrical activity to the heart. Okay, so your patient, you can be filling out a death certificate. I hope this helped. Hit me up, email me, send me messages if you want to see any other different explanations of things at nursing school. Good luck.